Hi, this is Dr. Schwartz, and today we're going to talk about understanding your screening mammogram report. Now, every woman over the age of 40 should undergo an annual screening mammogram, and you'll get back in the mail a report from the radiologist telling you about what he or she has interpreted on your mammogram. You'll get something called a BI-RADS rating, and that can range from 0 to 5. Today we'll talk about just BI-RADS 0, 1, and 2. BI-RADS 0 means the radiologist sees something on your mammogram and is unclear about what he or she sees and would like additional views with additional mammograms and sometimes ultrasounds to clarify the findings. Now, BI-RADS 1 is a great report. That basically means the radiologist sees absolutely nothing on your mammogram and recommends that you return to your annual screening mammogram. BI-RADS 2 is also a good result. It means the radiologist sees something but is 100% convinced that what he or she sees is completely benign and that you can return to your annual screening mammogram. Now, what does a screening mammogram detect? Screening mammograms can detect calcifications or calcium, which is can be the earliest forms of breast cancer, masses, and asymmetries. What is an asymmetry? An asymmetry is an area of the breast that looks unusual. Perhaps there's more tissue in that area of the breast than on the other side, and the radiologist may recommend a biopsy of that area. Screening MRIs are recommended in women that have a strong family history of breast cancer or high lifetime risk of breast cancer. They can detect masses and also something called non-mass enhancement that's not seen on mammograms. That non-mass enhancement can often also be a breast cancer and can be recommended for biopsy as well. Now, who should have a mammogram and who should have a screening MRI? That's really dependent on your risk of breast cancer, your family history of breast cancer, and the density of your breasts. And your breast surgeon, in conjunction with you and the radiologist, will determine if you would benefit from a screening MRI. Now, who should have a diagnostic mammogram? Well, if you come to your breast surgeon with a complaint, you feel a mass or you have nipple discharge, they'll often order a diagnostic mammogram. We'll talk about a diagnostic mammogram in a subsequent video. In addition, if you have a BI-RADS rating of 3, 4, or 5, you may also be recommended to undergo a diagnostic mammogram. And again, we'll talk about that in another video. Thank you for watching. If you like this video, don't forget to subscribe and hit the notification button.